Well, here we are again. Scott and I have known each other for, I think, over 10 years?
Yes, 10 years.
And he's been a patient here for a long time, and we've been dealing with this urinary problem for a while. And you had prior treatment before, it didn't work, and you also were placed on medication. And initially that worked a little bit, and then I had to increase the dose of that medication due to an enlarged prostate. And then that quit working, and then you finally had a procedure done recently. So it's interesting that you asked to see if we could do a video. So I'm really appreciative of you sharing your journey with other guys who, I mean, this is such a common problem, but guys don't talk about it and they ignore the problem until it's too late. So tell us a little bit about what you went through.
So I had difficulty with urination. I had to strain and push. You did the microwave procedure many years ago, and that worked for a while, but over the last couple of years, the problem came back a lot worse to the point where I wanted to get something done about it. And I was able to come in and see you, and I had the UroLift procedure done about 6 weeks ago, and the results have been phenomenal.
So tell me about how you were avoiding before.
My stream was very weak. I was going overnight about 3 to 4 times a night. Urination in public places was difficult, and I also had issues with impotence.
So you were telling me earlier that something about a ball game and what was going on there.
Yeah, anytime I go out to a sporting event, I find it very difficult to relax to urinate. I had actually gotten to the point where I was self-catheterizing in order to be able to urinate and go back to the sporting event easily.
So that's a big deal. Self-catheterizing, meaning you were sticking a tiny little tube into the bladder to help yourself empty.
Yes, that's exactly what I was doing.
Oh, that's pretty bad. And so we tried medication, it didn't work. And then I did a couple of tests to make sure that you are a good candidate for the UroLift procedure. You had that done, as you mentioned, about 6 weeks ago. Recovery, 1 to 2 weeks. Like you mentioned before, that you have some frequency, urgency of urination, a little bit of burning, and a little bit of pelvic pressure.
Yes. Yeah, there was some discomfort for about 2 weeks that finally did resolve. You just have to ride it out, but it was well worth the trade-off.
Okay. So tell me, how are things now?
Now things are wonderful. I only urinate once a night overnight. It's usually because I drink a lot in the evening. But the flow has been drastically improved. I can now empty my bladder a lot quicker. Also, at sporting events, I no longer have to do anything. I am relaxed enough that I can urinate in the sporting event without any difficulties at all.
That's phenomenal. And you briefly mentioned erectile dysfunction, urinary impotence, you said.
Yes.
And along the same line, same breath as enlarged prostate and urinary difficulties. So how has this procedure made any differences in your erections?
Yes, it definitely improved that as well. My wife and I were very happy about a week or 2 ago.
So I told you earlier that if I knew why that happens, and you're not unique in that, I have had numerous other UroLift patients who told me that their erections improved after the procedure. I don't know why, but there seems to be an association between an enlarged prostate and treating that enlarged prostate and then subsequently improving erections. Obviously, that is not the purpose of the UroLift procedure, but again, you're not unique. I've seen numerous patients with that improvement. So that's a nice bonus.
Yes, it's a very nice bonus, but I'm very glad that the urination problem is solved.
You bet. You bet. So what would you tell guys who are having difficulties, older guys especially, who are having difficulties with urinary difficulties?
I think they should take the chance, come in and get evaluated. I mean, I had some hesitancy. I don't like surgeries, but I did a lot of research and it seemed the safest way to go. I evaluated another option, and this seems to be a much more permanent solution. I'm hoping it is.
Yeah, and it's faster recovery. It's procedures done right here in the office, and it seems like within a few weeks you're like much better.
Yeah, in fact, the procedure was over in 5 minutes. I woke up and wondered what happened. It was very quick.
Yeah, that's the beauty of IV sedation.
Yes, no, it worked out fine. I was able to go home. Compared to the recovery from other procedure I had, this was much simpler.
I really appreciate you sharing your story, Scott.
Yeah, I'm glad to. I advocate all of patients that are struggling with this, come in and see you.
Thank you so much.
You're welcome.